fasting and you're eating less calories, then I assume you're losing weight. But what is the main benefit? Is it losing weight? Is it giving the digestive system a rest? Is it lowering blood sugar? Or is it kind of all of these things together?
Yeah, I think it's all of those things, because I think that if you look at lots of diets, so soon enough, I cannot say what we compared it with, right? But there's lots of diets. I would say most diets will cause loss of fat, loss of water, and loss of lean body mass, right? And sometimes even loss of bone density. And so, with the fasting mimicking diet, we don't see that. We already published the first study showing that, and now we're going to confirm that. So we don't see bone density loss. We don't see lean body mass loss. We do see it temporarily, right? So if you look at the subjects, both the cancer and the normal one, if you look at them during the diet, at the end of the diet, before they refeed, there is a small loss of lean body mass. But as soon as they go back to the normal diet, even after many cycles, for example, in this cancer trial in Italy, women receiving hormone therapy, they did up to 8 cycles of the fasting mimicking diet, and the lean body mass, if anything, increased. This was the treatment associated with also some muscle training, light muscle training. So that could have contributed, but certainly it was very encouraging to see that the lean body mass was not lost. And so then there is abdominal fat loss, and without the loss of lean body mass, and but also most likely after 5 days, autophagy is induced in multiple systems. And the breakdown, we see white blood cell count drops temporarily, not to an unsafe level, but it drops, and then as patient refeed, it returns to normal. So it's just suggestive of a multi-system cleanup, let's say, and then rebuilding, which we actually have demonstrated for mice, and also demonstrated the mechanism. Of course, for people, we haven't demonstrated, but we assume that some of the similar changes occur also in people.
So if you're underweight, so there's all these benefits that come. Would it work for underweight people? Mildly underweight?
Well, that depends, right? So we usually exclude, in clinical trials, we have, I think, over 20 right now going, and many we've completed. We always excluded for sure anybody under 18 BMI. Many of the trials we exclude people that are under 20 BMI. So I think the physician should be involved when we're getting to that, anything less than 20, and make a decision. What is the BMI reflective of? So if somebody has low BMI but potentially other problems, frailty, et cetera, they should definitely be excluded.
Okay. So would like eating FMD change with age? So if you're getting older, just in general, is fasting less of a good idea, or FMD?
Well, it depends again, and there is a personalization. So if somebody is let's say 79 and BMI 20, I would say don't do the fasting mimicking diet. If somebody 79 has cancer, breast cancer, and the standard of care is not believed to be working, so let's say metastasized stage 3 or 4, then I would say talk to the oncologist, regardless. Even at 79. And I'm not just saying it. This is what we do. We've been doing in the clinic for years now, and in the clinical trials, right? So the 79-year-olds are in most cases allowed in, but they're allowed in based on their the reason to be allowed in, right? So if they're stage 1 and they're doing fine with surgery, we definitely don't want to do a fasting mimicking diet on a 79-year-old. Now we're doing now, I think we recruited over 30 patients in an Alzheimer clinical trial, and of course that you're looking at a disease that is so so scary, right? And so damaging that we thought, yes, probably not the best thing that in a frail, 84-year-old that we want to do. But considering the disease, we went ahead and did it. And, of course, it's IRB approved, and and they were fine. I mean, surprisingly, right? Most of the great majority of the Alzheimer patients are fine, even after multiple cycles of the FMD, and we'll see what happens. Some of them are dropping off as expected, but I think that not as many as we expected it.
A couple of questions actually going back to kind of the FMD itself. Would you expect to go into ketosis in the FMD, like on day 3 or 4?
Yes, there's a lot of late talk about autophagy and ketogenesis and all of that, right? So we, I think, are in the business of making sure people live long and healthy. We're not in the business of increasing ketone bodies or increasing autophagy. Yes, the fasting-mimicking diet does increase ketone bodies, as we've shown from clinical trials. We're trying to we're not trying to go for the record ketogenesis, right? So we're trying to keep it higher, much higher, but not necessarily get into this yo-yo effect of fully ketogenic mode, full starvation mode, and back, because we're just concerned with what that could represent, going back and forth, particularly in those that do it too much. They're not listening to the recommendation and may, let's say, do it twice a month. Yeah.
So the FMD, what you described is full of kind of natural foods. Should it be fortified with anything, or it has everything inside it?
It has everything inside.
The kind of